It's not just so they can get money out of you. Hello guys, this is Vladan Stojanovic, your everyday dentist, and welcome to another video. You might be wondering why is it important to keep all our baby teeth in our mouth until it's time for them to fall out. After all, they will get replaced anyway, so why do we try so hard to keep them? P.S. If it is too late and your kid has already lost a tooth or teeth, I will tell you what can be done about it later in the video. First of all, good habits are developed early. Show me a kid who is age 5 and has all his baby teeth perfectly healthy, and that person might not need a root canal or even a filling by the age of 30. Another important thing, if the teeth are healthy in kids, there is a much lesser chance of developing a fear of dentists or even a phobia. According to statistics, 36% of adults have a fear of dentists, and 12% of them have a debilitating fear of dentists. There is a much lesser chance that they will develop this fear if they don't have to undergo some radical procedure while they are young. So, while both of these are important, habits can be corrected later. Fear of dentists can develop anyway without any prior bad experience in a dental chair. However, the most important aspect is space. Space is important. Our baby teeth are meant to maintain space for our permanent teeth to grow into. So, while all are important, habits can be corrected later in life. Dental fear can develop as well without any prior bad experience with dentists. However, space is the big one. Space is the most important reason why we have to keep our baby teeth healthy. Our teeth have a tendency to move into empty space. If, for example, you're missing an antagonist tooth, that tooth will tend to keep growing until it hits something that will make it stop. If we are missing a tooth next to the one we lost, the teeth on the side of the empty space will tend to want to fill that space. So they will move a bit and they will tip a bit into that empty space, thus losing us the space necessary for a permanent tooth to grow. Permanent teeth have a specific order in which they come out. It's truly beautifully designed. It allows for development of correct jaw alignment, of correct dental occlusion. It allows for space for big canines that will develop later, that are much larger. It's truly beautifully designed. So, what happens if we mess with natural order of things by eating one too many peanut butter cups? We easily lose space meant for permanent teeth. Some authors even indicate that it's not even necessary to lose a tooth. It's enough to just get a proximal caries in our primary dentition, and it's enough to lose a bit of space. And that bit of space might have been totally necessary for our permanent teeth to grow into. If we are unable to prevent this, you can be sure that an active orthodontic appliance will be required. And this is if everything else is perfect. So if only problem with your kid is that he lost his baby tooth too early, if we add any of the most common problems with jaw alignment, with jaw and teeth size relationship, with supernumerary or missing permanent teeth, with impacted teeth, anything like that, it will just exacerbate the main problem, and we might have to resort to more complicated orthodontic appliances or even teeth extraction and braces later in life. Okay, so what to do if this has already happened to your kid? If this has already happened and we have caught it in time, we can make a space maintainer. Me personally, I prefer a removable orthodontic appliance that will keep the tooth in its place. If some little space has already been lost, we can even add to it some active components that you can turn at home per your orthodontist's instructions, and we can even recover the space lost. The negative side of this is that we are forcing a 6-year-old, 7-year-old, 8-year-old to start wearing the orthodontic appliance very early. He will have to wear it until all the permanent teeth are out, and if that was the only thing that he needed, it wouldn't be a problem. However, most kids will need some kind of orthodontic treatment anyway, if they want that perfect Hollywood smile at least. So the kid will have to keep wearing that orthodontic appliance whose sole purpose is to just maintain space until when we can start addressing his individual problem. And then we will have to make a different appliance which he will wear. It will keep maintaining space if it is necessary, but it will also do what is necessary for that individual patient. So by doing that, the kid and even his parents might get really sick of wearing the appliance, and that gets us to another problem with a removable appliance. If the kid doesn't wear it, if the parents are not encouraging him to wear it, it does nothing. It does nothing at all. We can do whatever we like. If the patient doesn't wear the appliance, it does nothing. So patient and parent cooperation in this case are necessary. There is another thing we can do. This option I like much less. We can do a so-called fixed space maintainer. It's a ring around the tooth that's kind of leaning on the adjacent tooth and keeping the space between them. The negative side of this, it's, in my opinion, more brutal for the little guy. He has to have a metal construction in his mouth for years. And the other, even more important thing is that it can cause early caries in first molars, which already are teeth that most easily get infected. And in addition to that, they are the most important teeth for us later in life. I am Dr. Vladan Stojanovic, your everyday dentist, and I will see you in the next video.